got plenty, but that's okay.
Okay,
Yeah.
so a part of this release is that you can feel quite emotional from it, or you can feel like everything's light, or like clients that sometimes say they have a feeling of euphoria coming. It just depends on where you're at and what you're holding on to. Right. So I want you to think of breathing into my hand over here. Nice big deep breaths in. So try not to breathe at the top here. Just try and breathe into my hand first. So push my hand out. Right. We're going to have to do it the other way for you. Just because she's breathing front first.
Yeah. Alright. So if you can't get them to do it one way, just do it the other way.
Alright. So I want you to push my hand away with your chest. So breathe up into your chest first. Nice big deep breath in. And breathe out. And again, deep breath in.
So essentially what you're doing is you get them to do normally 2 breaths, 2 to 3 breaths, depending on how far you can get. You're compressing with each one. So as they breathe out, you're not actually lifting back off. And then on the last one, you suddenly take it away. And it creates a forced inhalation. Yeah? So you can do it upper chest, as she's just done. This is obviously more specifically diaphragm.
Yeah. Try and breathe into my hand here now. Just going to adjust it. Alright, let's try and get into my hand here. That's it. Deep breath in, try and push my hand away. Deep breath in again.
Okay? And that is what you want. It's a good reaction.
Yeah, fine.
It can be emotional though. There is one other one. Those are the 2 that I would use mostly. There is one other one that you can do, which is this one. Again,
Breathe in.
quite difficult as a therapist as well
Breathe
sometimes,
out.
depending on the size of the person.
Breathe in. Breathe out. One more breath in.
Didn't quite do the same.
Yeah.
No. But it's very, especially if you've got a big person.
And it depends also if they can isolate the breathing, because obviously, you know, you're trying to get them to isolate them to those points. This is also a form of mobilizing to a point. It can release through the ribs and things as well. If they've had, I wouldn't suggest doing this on your asthmatics to start with. In fact, I pretty much never do it on somebody who's had, because that feeling is horrible. As an asthmatic who had to do it in class, especially not in class situation. Yeah, it's not nice.
So you don't want to try it on me?
No, not today. Not seeing as you've had problems for the last few weeks. No, we won't. Don't want to give you an asthma attack. Any other one?
The other one I was showing was them breathing, and then as before you release, they take 2 quick breaths and then you release, but I don't like that.
Yeah,
Because they anticipate it.
yeah. The good thing with this one, and if they start anticipating, I actually, like if I was doing, you know, if I did upper and lower, I would change which breath I released on, because they'll actually start to expect it. Yeah. The other thing you can do, which I didn't do before, is you can actually, again, I wouldn't do it on anybody to start with. However, if somebody's further along and they're comfortable, again, somebody with trauma, probably not. You can actually get them to cough when you have your fingers in them. Do you mind? Okay, so if you've done your normal treatment and you're managing to get in fairly deep and you're managing to stay in and hold it deep, on the last one when you can't, you can actually get them to cough into and hold that compression up. Can be very uncomfortable. I'm not going to do it very deep because we haven't done it properly, but essentially, sorry, my hands have probably got cold again. Let it sink in. Actually, I'll spray it at you first. Just spray it properly. So you're gonna breathe out. I'm gonna stay in for your in breath, and then instead of breathing out for the second one, you're just going. It's a little cough, just a. That's it. Okay? Not like a. Just a. Yeah, it's just the movement you want to. Okay. So I sink in. I'm not gonna go too deep in that. I want to hold it. So then you're gonna breathe in. And then cough, and then you come. And that's it. Just adds a little bit Well, actually, you tell me, what do you think it does? What are you trying to do?
Well, you're actually doing a type of, kind of a type of a reciprocal inhibition.
Yes. So it's the only way that you can kind of create that reciprocal inhibition in this form, because you're forcing, because obviously breathing is, you know, it is moving it, but this is a forced contraction. Yeah.
Oh, like opposite of what you just
Yeah, and the opposite of what, yeah. But again, if they've had breathing issue, you know, this would be something that you would only do with somebody if they were quite comfortable with you doing, you know, 2 to 3 breaths where you've sunk in and stayed in, then you might do it at the end. Yeah, obviously, if you're struggling to get in, wouldn't do it. Yeah. If they have, again, most people with a breathing condition, you wouldn't ever get to do this in because you just never get there. Even the compressions, if they had had a good patch in their breathing and you were starting to get a little bit better with your treatment, you might be able to do them. However, the issue with people with a breathing problem is that sudden kind of, well, one, the pressure, they'll feel like they're not breathing. So as soon as you start to compress, especially the one on their chest, as soon as you start to compress there, they're going to feel like they can't breathe at all, even if they can. Psychologically, they're going to be like, I'm not breathing. Because that's what it feels like when you're having an asthma attack often, is that real heavy pressure on your chest or wherever. So that pressure is actually what will traumatize them sometimes. Or when you take that off and they get that, it's that same reaction that you would often have if you were having an asthma attack or an issue with your breathing. So I would generally not even try, just from a trauma and psychological point of view, depending how severe obviously their asthma is. I mean, if they're kind of more like, say, maybe an exercise-induced asthma when they were a child and they haven't had it for like 30 years, then I mean, I might, once I'd done other stuff. If they were, you know, a lot, I mean, obviously there are different types of asthma. You know. There's wet lung and dry lung as well. I would never do any of these on a wet lung. You can use percussion on a wet lung, just slightly different, and they do use the compression and stuff, but it will make them bring out gunk and things like that. So for what you guys are doing, I wouldn't suggest doing it on them, because you have to do it very specifically. Because a wet lung, obviously they have fluid in their lungs, so you don't really want to be playing around with that unless you understand what you're trying to do. So I would check that before I did those kind of ones. So if you want, you guys can have a go at those. Yeah, because it's good to know how to do them. So have a go, and then